Imagine you're getting your child ready for bed, and as you pull their shirt up, you notice a rash that wasn't there this morning. Your mind races. Is it serious? Should you call the doctor? Rashes in children are incredibly common, but knowing which ones to worry about can be a challenge. This video will help you understand the most common types of childhood rashes, how to spot them, and when it's time to seek medical help. Section 1. Why do rashes happen? Rashes are a visible response to something happening inside or on the body. Whether from teething, bacteria, fungi, or viruses, rashes develop for a variety of reasons. Some are minor and will go away on their own, while others can be serious and require medical attention. Knowing why our rashes occur is the first step to feeling prepared. For example, teething rash occurs when drool from a baby's mouth irritates the skin, causing small, inflamed bumps around the mouth, cheeks, and chin. It's common and clears up with gentle care. But on the other hand, something like impetigo, caused by bacteria, can result in itchy sores and requires antibiotics for proper healing. Section 2. Rashes you can treat at home. Some rashes can be safely managed at home, meaning you can help your child without rushing to the doctor. Let's look at a few. 1. Diaper rash. Babies often develop this due to moisture and friction from diapers. You'll see raw, red patches around the diaper area, sometimes with blisters. This type of rash can be treated with diaper-free time and protective creams. 2. Cradle cap. This one shows up as yellow or white greasy scales on a baby's scalp. It's not harmful and typically disappears on its own with regular washing. Sometimes it can affect other areas, like the diaper region, and looks like small, dry flakes. 3. Heat rash. When sweat gets trapped under the skin, small, red spots appear, sometimes accompanied by itching. Keep the child cool, avoid tight clothing, and the rash should clear up quickly. 4. Eczema. This is common in children and involves dry, itchy, inflamed patches of skin. Eczema can often be managed with moisturizing creams and gentle, fragrance-free soaps. But if it doesn't improve, you may need to consult your pediatrician. Section 3. When rashes signal something serious. Some rashes are indicators of more serious issues and need prompt medical attention. Here are a few to watch out for. Meningitis rash. This is a rare but serious condition. Meningitis causes inflammation around the brain and spinal cord. The rash appears as tiny pinpricks that can quickly spread into purple blotches. It won't disappear when pressed with a glass. If you see a rash like this, take your child to the emergency room immediately. Scarlet fever. This bacterial infection typically affects children aged 5 to 15 and begins with a sore throat and fever. Soon after, a rash that feels like sandpaper spreads over the body. Scarlet fever requires antibiotics, so contact your doctor if you suspect it. Measles. Highly contagious and preventable by vaccine, measles starts with cold-like symptoms and white spots in the mouth. A rash will then appear, starting on the face and neck and spreading. Measles can be dangerous, so be sure your child is up to date on their vaccinations. Section 4. Viral rashes and how to handle them. Many viral infections result in rashes. While these rashes can often be treated at home, it's important to recognize them. Chickenpox, the classic rash with itchy, fluid-filled blisters caused by the varicella zoster virus. It's highly contagious, so keep your child away from others until all blisters have scabbed over. Fifth disease, known as the slap cheek disease, this causes a bright red rash on the cheeks, followed by a lacy-looking rash on the body. It fades in about 7 to 10 days. Hand, foot, and mouth disease, this rash appears on the palms, soles, and sometimes other areas. It's caused by a virus and usually clears up on its own, but a fever or sore throat may also accompany it. Section 5. Fungal infections. Ringworm. Despite the name, ringworm isn't a worm but a fungal infection. It appears as ring-shaped, scaly patches on the skin, usually with a clear center. It can show up on the body or scalp and needs antifungal creams or medication to clear up completely. Section 6. Contact dermatitis, avoiding irritants. Contact dermatitis is another rash type caused by contact with an irritating substance. This can be from household items like soaps, lotions, or plants like poison ivy. Signs include redness, itching, or blisters. Identifying and avoiding the trigger is key to stopping the rash from returning. Section 7. Vaccination and prevention. Some rashes are preventable through vaccinations, like measles and rubella. The CDC provides vaccination schedules that protect children against these serious conditions. Stay updated on your child's vaccines, and if you think they've been exposed to one of these viruses, contact your doctor. Section 8. When to seek help. Most rashes don't need an emergency visit, but there are times when you should take action. Reach out to a healthcare professional if the rash covers a large portion of the body, it's accompanied by a high fever, or you notice symptoms like purple blotches or tiny pinpricks that don't fade when pressed. And remember, any rash that doesn't improve after a few days of home treatment should be checked by a doctor. Conclusion: knowledge is your best defense. Having the right information empowers you to take action when your child develops a rash. While most rashes are manageable at home, it's crucial to know the signs of something more serious. Your child's health and well-being are always the top priority. If you're ever in doubt, don't hesitate to consult with a healthcare professional. Thank you for watching, and be sure to subscribe for more content on child health. Stay informed, stay prepared, and keep your family healthy.